A common misconception when it comes to head injuries is you go and get your eyes looked at because they're sore, they hurt, or they're irritated. The optometrist checks your eyes out and they tell you that everything is fine. Now, you have to keep in mind that when you're looking at your eyes, there's a lot of different things that you're looking for. Primarily, an optometrist is trying to check to see, in terms of the structures themselves, is there anything to worry about? However, when we're looking at concussions on our side of things, we're looking at the eyes a little bit differently. So, although we're not looking at the eyes themselves at all in terms of seeing, are you able to see? Is the retina okay? Is the cornea okay? We're not really looking at that aspect. We're looking mostly at the aspect of, are the eyes functioning in terms of neurological inputs? So, what I mean by that is, are you able to perform smooth pursuits where your eyes are tracking something? Are you able to perform saccades where your eyes jump from one target to another target? Are your eyes able to fixate on a target, so a target that's not moving or potentially moving, but can you hold your eyes locked onto that target? Do your eyes move in an adequate fashion to oppose head movement if you're trying to fovealize on something when your head is moving? Do you have a proper optokinetic after response in terms of those fast eye movements? So there's all sorts of different types of eye movements that we're kind of checking to see, are those mechanisms working okay? Now that's one of the reasons why you may have got a all clear okay from the optometrist, but that doesn't necessarily mean everything is okay with regards to your eyes. Now, another important factor to consider is when someone is looking at your eyes visually, sometimes they're not able to find all of the diagnostic values or all of the tiny little imperfections that might be picked up with computerized testing. So it really makes a difference. Also, when someone is testing your eyes with just visually kind of tested metrics, compared to more computer diagnostic metrics that can kind of discriminate between milliseconds of difference or kind of degrees that your eyes might be off by. So that also makes an extreme difference when you're kind of measuring those eye movements to dictate, is everything okay? Are you reaching the standards, or are there things that just aren't quite right there?